the field that I am representing at this time, even being a fully trained interventional cardiologist, I am representing endovascular medicine specialty. What is endovascular medicine? Is the specialty that take care of the circulation outside the heart. Like we were talking in Dr. Llanos, and the most common effect or adverse effect of diabetes is produce blockages in the heart. This disease is called atherosclerosis. But this deposit of fat, inflammatory material inside the arteries does not happen only in the heart. They are systemic. When it happens in the heart, we call it, as the physicians call it, coronary artery disease, and put the patient at risk for heart attack. If this happens in the neck, we call it carotid artery disease, and put the patient at risk for a stroke. And if it happens in the legs or in the arms, we call it peripheral artery disease, and put the patient at risk for amputation. That is my specialty. When this disease is affecting the circulation outside the heart. And diabetes, unfortunately, poorly controlled diabetes accelerate this progression of atherosclerotic disease. It's going to be faster, it's going to be more aggressive and more diffuse. There are different ways. For example, we know if the patient is a smoker, we know the arteries that are involved usually are in the abdomen, in the iliac, what is in the abdomen and the pelvis area, and even in the thigh area. But when we know that the patient has diabetes, is very severe, usually below the knee. The circulation below the knee in diabetics gets very, very, very challenged several times because the arteries are smaller and the arteries are very calcified, very difficult to treat. That is why the patients, if they develop a small ulcer in the toe, a small ulcer in the feet, the risk for amputation is significant, much higher than even a smoker. Diabetes has become the #1 cause of amputation in the whole United States. It surpassed smoking that used to be the #1. It is very important to mention that the most advanced stage in peripheral artery disease, we call it critical limb ischemia. You are going to hear CLI fighters. And basically, what is CLI? Is critical limb ischemia. That means the quantity of blood that gets to the feet is so little that even at rest, the patient can have symptoms. And these symptoms usually are pain at rest. When the patient has moderate, severe blockages, the pain is only when they walk. We call it claudication. Oh, doctor, before I used to walk Walmart and I could do my shopping, no problem. But now I walk half a block, oh, my calf hurts. I need to rest for a minute before continue. That's called claudication. But if the pain is even at rest, that means it's a more advanced stage. This happens at nighttime. Doctor, when I sleep comfortable, but in the middle of the night, I wake up with cramps. My feet, it feels cold, it hurts. And I need to sit in my bedside, or I need to walk to the restroom. And then when I return, my leg doesn't hurt, and I can sleep a couple of more hours. But probably I will wake up in a couple of hours again. That pain at rest at nighttime is something severe. It's not only moderate peripheral artery disease, it's a severe peripheral artery disease, it's a severe stage. If it gets worse, it happens when there is a wound that doesn't heal. Non-healing ulcers are correlated very well with poor advanced peripheral artery disease. And even more extreme, if the patient develops a tissue loss or gangrene, when the toes turn black, or the muscles get weak in that way, that is a much more advanced stage of peripheral artery disease. But the problem with critical limb ischemia is not only in the legs, because that put high risk for amputation, but having critical limb ischemia prognosis is even worse than many of the cancers that we are dealing with, because it would put the patient risk for a stroke, patient risk for heart attack, and mortality gets as 25% in 1 year if the patient has already a gangrene toe or an ulcer that doesn't heal, what is extremely high.